Education Forum would like to share with you these articles which address the integration of social determinants of health into curriculum. And for curriculum here, we mean not only the curriculum of the medical schools, also the curriculum of medical and health science schools. This just overview of the journal. This article published in Medical Teachers with the impact factor of 4.7, publisher Taylor and Francis online, published monthly since 1979. And this article is identified as AMI Guide, which is identified by this journal, which is published by the Association of Medical Education in Europe as a valuable learning resource that could be used as a guide to enhance the curriculum planner and curriculum designers, with more than 1 million article downloads at annual phase. I'm presenting these articles on behalf of the authors of these articles from the University of Limerick and from University of Toronto from Canada, and also from University of United Arab Emirates University and Gulf Medical University. In this presentation and in this 1 hour, we would like to navigate through the defining social determinants of health and its important and benefits, and then discussing a brief summary from the literature about social determinants of health and the framework for integrating social determinants of health into curriculums. What are the appropriate teaching and learning and assessment methods, and then what are the factors outside of the curriculums from the population and health system addressing the challenge. And we have actually published case studies within this AMI Guide. I'd like to go together through 4 case studies from this AMI Guide, and then we'll also discuss recommendations of change. Actually, the WHO defines the social determinants of health as the non-medical factor influencing the health outcomes. And this social determinant of health associated with the condition in which people are born, grow, work, and alive. Medical schools and the licensed bodies across the globe, they are recognizing the importance of integrating this social determinant of health in the curriculum. However, there is no structured framework, and there is no agreement on how to integrate these important elements into the curriculum, because nowadays the role of the health professional is not only to treating the patient. The role is extended beyond treating the patient to understanding the issues that really affecting the patient and the population health. And actually, most of the issues that affecting the patient and population's health are not from the medical factor. So for this reason, this guide aimed at taking an evidence-based approach grounded in the available contemporary literature and case studies. And the focus is on integrating the social determinant of health not only at undergraduate level, but also at postgraduate level and the residency training, with the aim to promote the social factors that influence patient and community health. And ultimately, this guide seeks to contribute to the reduction of inequality in health at general. So as in the introduction, the WHO defines the social determinant of health as a non-medical factors influencing the health outcomes. And the social determinant of health have been defined as by Dahlgren and Whitehead as life circumstances in which people are born, grow up, live, work, and age, and the wider set of forces and systems shaping the conditions of our daily life in everything affecting our life. And actually, it plays a key role in shaping the health and well-being of individuals and communities. And for this reason, the WHO Commission on Social Determinants of Health 17 years ago focus on reorienting the health system to emphasize on health promotion and population health, and moving from disease-oriented education into health-oriented education. Given the significant impact of social determinants of health have on the health and well-being, there has been a clarion call to prepare the doctors and other allied health professions to address the social determinants of health at the patient level and at the community level. So this is the foundation of conducting this study. And from the literature, and as you can see in this screen, there are a lot of benefits from integrating this social determinant of health into the curriculum. Studies show that integrating this social determinant of health into the curriculum augment medical and health sciences students' aptitude, skills, and passions to act as clinical decisions are largely influenced by the interaction between the clinician, patient, and the socio-cultural background. And also, studies show that integrating this determinant into the curricula create an awareness among the healthcare practitioners of the effect of the social and legal issues on people's health and well-being, as highlighted by Jacob 2019. And also, as highlighted by Sharma in 2018, engage residents and physicians directly to the patient to explore the social, cultural, and economic factors that influence healthcare decisions and treatment. Additionally, this is very important. And it also studies show that, as highlighted by Luis, to assist patients directly or through the referrals with health concerns that do not essentially necessitate medical care. A lot of health concerns not directly related to the medical care. And understanding the social determinant of health also helps the patient health and individual level and community population level to reduce health disparities and enhance health equality, and also create opportunity for health profession institutes like the medical and health institutes to apply interprofessional educations and multidisciplinary involvement. And as you know, applying this approach will affect positively the patient care and a good impact on the community. And also, studies show that it assists in the graduating physicians and healthcare practitioners who are socially and cultural sensitive, because we are graduating students or graduates that will work in our countries or regions, and some of them will try to pursue their careers in other countries. So this is very important to have a graduates who are culturally sensitive and able to work in different settings, including the rural and underserved areas. So a lot of benefits have been identified from the literatures with the rationale to integrate this social determinant of health into the curriculum. And therefore, as a result of that, the WHO developed a conceptual framework for integrating the social determinant of health into the curriculum. And this framework including the knowledge, the skills, and the attitude. And for the knowledge, they highlight the importance of integrating the income and wealth into the curriculum, and the importance of education, and to identify the relationship between the education and the health outcomes, including the impacts of low literacy and numeracy on health. And also at the knowledge level, the employment and working conditions, and how this can affect our health and the health outcomes, including the impact of job and job insecurities and poor working conditions on health, including the occupational health and so on. And also the social support network and how can relate to health, the physical environments and the neighborhood and community, and how they are impacting the social and the physical environment of the health and the other issues, such as crime, health foods, community cohesion, and so on. Very important issues related to race, ethnicity, and culture, and their relations with their health. Also the genders and sexuality, and how the genders are affecting our health, and also the political, economical, and social systems, how they're important in health, addressing issues such as the healthcare policy and access to health. These are the knowledge aspects that should, and related to the health determinant, social determinant of health, that should be addressed in the curriculum. For the skills, it's not only we need to make our students skillful in taking histories. There is a call for educating them about how to take the social history carefully and in organized way, and how to collaborate with the team, including the different healthcare professionals. And here it is the time to go toward interprofessional education and practice. And I think we have here in the campus a good opportunity to foster this approach. And this is one of the agenda of the health professional education across the coming years, inshallah. And very important, we need a graduate, those who can demonstrate interpersonal interaction and communication skills with community, with emphasis on the social organizations. And they need to know very well the sociology as part of the important science. Leadership skills is very important at institutional and at community level. They have to know how they can talk to the community, how they can lead initiative within their community, and so on. And most importantly, perform simple community diagnosis to identify the magnitude of the social determinants of health, of health problems at societal level, and contribute to its resolutions. When it comes to attitude, we need to have a graduate to be culturally and socially sensitive and alert when confronted with these issues and also to respect beliefs, values, and religion of individual society, and to demonstrate interest, commitment, and helping attitude, and try to best find solutions facing difficulty in health. So this is the WHO conceptual framework of integrating the social determinant of health. In the next 4 slides, we'll go through different experience out of the case studies that we presented in this AIM guide. I extracted from them four experience: one experience from US, one from Canada, one from UK, and one from Sudan. From US, University of California, San Francisco, this university provides 3 years curriculum and longitudinal curriculum. And in year 1, the goal of social determinants of health is to understand how individuals and community bear problems. They are interrelated with each other. They design their curriculum in a way that address these important goals. While in year 2, they focus on how community and stakeholders approach such problems that has been identified early by the WHO and the important elements of the social determinant of health. And finally, in the year 3, the emphasis is on the formation of the partnership and interventions, including skills training on the development of logic models, sustainability, and accurate communication skills. The second case study is from the University College, London Medical School, United Kingdom. They are using most predominantly the flipped classroom approach, and using this approach, they provide the learning materials related to health inequalities in UK, describing why health inequalities exist, describing the causes, healthcare models, and descriptions of life course concepts. And they have simulated patient tutorial in which students are tasked to analyze the role of every healthcare professional, the application of the knowledge of health inequalities, enhanced skills in taking social history. They are focusing on social history and understanding of the most appropriate intervention at individual, local, and national level. And these outcomes actually are achieved through the investigations using the public health outcomes framework, and they are using interactive presentation, YouTube, TED Talk, diagrams, written explanations, and quizzes, applying these 6 recommendations It's called Marbot 6 Recommendation to Real Life Public Health Initiatives, group social history taking from simulated patient, students' reflections on the reasons for taking social history, and brainstorming sessions with the students. University of Toronto from Canada, they have in their first year, students are oriented to the concept of surface learning and social determinants of health. And and surface learning is related to considering the reciprocal relationship between the educational institute and the community. And students are provide services to the community under supervision while they are doing their learning period. And at the end of the year one of training, community organizations are introduced to the students by their tutors, and they have good relationship with their community. And at the start of the second year, tutorial groups and the tutors visit their community partner sites. They have a member from each partner sites, part of represented in this college for tutorial sessions, which serves as an orientation. In the subsequent field visit, the students focus on learning about the community and the community partners, paying a particular attention to address the challenge and discussing people solutions. In this field experience, the students participate, observe, contribute, and learning about advocacy. Field visits are punctuated with small group tutorial sessions, which offer the opportunity for reflecting as well as debate and discussion of major themes and topics connected to the community engaged learning. And finally, at the end of the year, students, community partners, faculty, and administrators attended a community forum where students prepare a poster presentation to share their experience with the community partners, faculty, and peers, and accordingly, decisions will be taken to share the community. University of Jazeera from Sudan, which is identified as a good example of social accountable institute worldwide. They have the interdisciplinary field training and research. And during this course, which is delivered across the first 3 years of the curriculum, small group of students from different faculties, not only the College of Medicine, they assign together and they visit a village. In the first phase, the students identify health problems and they interact with each other with other colleagues, such as the College of Agriculture, College of the Business Administrations, and engineering, and so on, to the and their social cultural determinants using various investigation tools, including questionnaires, interviews, observations, and qualitative methods, such as focus group discussion. In the second phase of the curriculum, students execute project because they plan in phase one. In the second phase, they execute a project through full community participations to solve one of the major problems identified in phase one. And in the last phase, phase three, students study to what extent the measures implemented in previous phase has been successful. And this is evidence that the integration of social determinants of health in this course is well implemented. As a framework of integrating social determinants of health, we can consider the horizontal integration as seen here in this image in cardiopulmonary system course. And how can the immigration, migration, gender and sexuality, races, ethnicity, neighborhood and community, social support, network, employment, working conditions, education, income and well-being, and health, political and economic affect our health. And at vertical level and vertical and spiral approach, it can be in this way. We have the clinical science, social and behavioral science, community health, leadership, and personal skills. And we have these elements such as income, education, employment, social support, how we can create a spiral approach integrating this social determinants of health across the curriculum from day one till the graduations. And I have to thank our educational technologist, Mohamed Ashraf, who has designed these figures and this image for this AME guide. And now we will move from planning the curriculum to how we can teach this social determinants of health in the curriculum. The best teaching and learning approach is to use the surface learning in educating the students about the social determinants of health and incorporating these surface learning opportunities, such as volunteering within the community, and give them the opportunity to learn about it. And also community-based education. And the difference between the community-based education, where we send the students to the community and their learning process will be within the community. In surface learning, we have the reciprocal approach. Students will learn and will provide service at the same time. And providing service is one of the most important and intention while sending the students to the community. Interprofessional education, as you saw, as you see in the experience from University of California and University of Jazeera, Sudan, they have not only interprofessional education, they have the multidisciplinary approach, case-based learning, and we can use also problem-based learning, simulation-based educations, and also the self-directed learning. And we have the good opportunity to apply this in our college. These slides provide step-by-step guide to implement social integration of social determinants of health into the curriculum. And in this, we will discuss the planning, the implementation, including the delivery, the assessment, and finally, the program evaluation at the end. At the planning phase, it's very important to ensure the commitment of stakeholders while leading this initiative in integrating the social determinants of health. And for the stakeholders here, we mean the internal stakeholders, including the students, faculty, all supporting staff, and the external stakeholders that are related to the university, maybe people from the health system, Ministry of Health, and the other stakeholders, including the community. Very important to create an active leading group or task force affiliated with the curriculum committees. And it's very important to conduct a rapid need assessment. And by conducting this rapid need assessment, you will identify what exists in the curriculum, because I believe that many of these elements are included in most of curriculums, while we need to contextualize and to make sure that we are giving the appropriate information to the students at the appropriate level. And it's very important to identify the learning outcomes at program level and at the course level. This is at the planning stage. When it comes to the implementation stage, we need to revisit the integrations as we presented in the framework, and we need to identify the content, and we need to create a working group again for at course level, and we need to also to ensure the faculty development, how we can make sure that we are delivering this in a good way to the students. Very important to start with the curriculum mapping and doing the blueprint at master level, including the programmatic blueprint, and also to think about what are the suitable instruments that can be used to integrate this social determinant into the curriculum. Very important when we start planning and with the we have to consider the outcomes, and for the program evaluation, we have to use the appropriate program evaluation models by which we can conduct comprehensive program evaluations and make sure that we have delivered, or we have made sure that we have this integration in a proper way. And also we have to work on research and advocacy for this social determinants. Definitely, we have identified several challenges by several medical schools, including limited resources, including also limited understanding of the scope. What are the social determinants of health that should be prioritized in each schools, and then also definitely like in any organizations, resistance to change also need to be considered. And it's very important to think about to standardize the training, how we can standardize the training while integrating these important aspects, social determinants of health. And this need actually collaborations and effort of all. And also, very important to gather and analyze data on social determinant of health, and these for each country. We need also involvement of the community and the partners and the representatives of the community, and who should be engaged from the community and who should lead the community, and also the practical application. And we believe that with good representation of the stakeholders in the schools, such as the advisory board, and they are involved and they are engaged in a good way with these medical and health science schools, I think all this challenge will be mitigated and will be overcome. The practical points from this AME guide is the integration of teaching on social determinants of health produce not only physicians and health workers who are better equipped to fulfill the demand of the community they serve, and social determinants of health integration requires the development of a curricular framework. Following the development of a curricular framework, agreement should be reached on the breadth and depth of the content with curriculum mapping over the different phases of the curriculum. Definitely student-centered approach such as surface learning and community-based education has been proven to be an effective strategy for integrating social determinants of health. And the last practical points from this AME guide, changing external factors that may influence curriculum development should be anticipated and managed, because we have different external factors. You can scan this code to reach the articles, and also will be shared with you. This is just briefing about the integration of social determinants of health into the curriculum.